Welcome to Change the Narrative. I'm your host, JD Fuller.
I'm Susie Younger,
an African-American licensed psychotherapist.
I'm also a licensed therapist.
We talk about the isms. We talk about the phobias, anything that marginalizes and oppresses.
As a white woman, I ask the questions white people are too afraid to ask.
Everything we are not and everything we are is because of fear. Through a mental health lens, Susie and I will have difficult conversations with celebrity guests, political activists, and everyone in between. Our mind will tell us whatever we want to believe, but the truth lives in the body, and that's where change occurs. Are you ready to change the narrative?
Well, welcome everyone. Our guest today is a board-certified plastic surgeon. Dr. Dimitri has won multiple awards, graduate of Columbia University, and has authored over 30 peer-reviewed publications and book chapters. He's also part of the esteemed Haute Beauty Network, which is an exclusive publication representing an elite clientele of physicians with only 2 doctors in every major market. He works in both Florida and LA. He's also a cutie patootie who is off the market, boys and girls, as he just got engaged. Welcome, Dr. Dimitri.
Thanks so much for having me, guys. Excited to be here.
Well, congratulations on your engagement.
Thank you very much.
So what led you into plastic surgery?
Just like I think in any career path, it's really once you find a mentor, they, lead you down your path and you look up to someone, you respect them, and you try to eventually emulate them. And I was fortunate to do some head and neck cancer reconstruction research at Johns Hopkins Hospital a long time ago. And as many people are aware, it's one of the leading hospitals in the country. And one of my mentors then was doing just some amazing surgeries in reconstructive surgeries. And then I did my training in Dallas. And as many people are aware, Dallas is a kind of highfalutin city and a lot of cosmetics going around there. And that kind of led me down that road. So eventually I made it out to the Mecca of plastic surgery in Beverly Hills. And I've had an amazing experience, and I've been fortunate to develop a busy surgical and injectable practice, both here in Tampa, Florida, where I'm at right now, and in Beverly Hills.
Wow, that's amazing. That's quite a journey. Thanks for sharing that with us. So we have some questions that have to do with sort of the people who get plastic surgery. Mm-hmm. And one of the things that came to mind was, do you have any concerns about body dysmorphic disorder? And kind of, how that shows itself in the practice.
Yeah, major concerns. That's really, that's why when we see patients for consultation, we screen them, we obviously listen. The number one thing is to listen to your patient and to hear their concerns. And then it's up to your clinical judgment to see if their concerns actually match reality. And you're right. A lot of times patients come in and someone will complain about a little bump on their nose, and it's the most minuscule tiny thing, and putting them through surgery would actually probably create more problems. Okay. And that's when obviously you would want to get a psychologist and a psychotherapist involved and have those patients evaluated for body dysmorphic disorder, because you would truly be doing them a disservice if you ended up doing a procedure on them.
Well, I appreciate hearing that. So you will decline a patient based on psychological reasons.
Oh, 100%. And again, it's if you, it's sad, but their greed can become a factor, just like in anything. And as a plastic surgeon, you make a living by doing procedures. But there's also ethics to this, and you want to make sure that you're doing the right thing for someone. I'll add on, in this day and age with social media and all these filters, it's really, with young people, they're easily influenced by their celebrities. You see all these pictures of Kim Kardashian and all the Kardashians, and, it's like, oh my God, what did they do? And I have, Bella Hadid and so many young patients come in and they show me their photo and they were like, make me look like that. And it's just like, that's not realistic. And, it's my job, I think, to kind of, bring them back to reality.
That's pretty painful, but you perfectly led me into my next question, which has to do with more of a sort of a cultural perspective. So, as Black women, we've been ridiculed forever about big butts, big lips, weaves. And it didn't become a thing until white women started to appropriate the cultural norm. And I guess, now you might consider it mainstream. I think it's pretty disturbing from my lens, because over the years, I've seen Black women and other women of color sort of get into this process. And it's interesting because it reminds me of when Tommy Hilfiger, co-opted the urban clothing, right? And then he blew it up, made it expensive, and then sold it back to the community he took it from, right? And so that's sort of what it feels like is happening now, is like, now that it's been appropriated and it's gone mainstream, what's happening is that it feels like women of color feel like they have to, propelled to get in there. And it's creating distorted looks for so many women. It's really disturbing. What's your take on that?
Yeah. So, I mean, first is I just try to be conservative, in all things that I do with my procedures. And I also just focus on the face. So that's my specialty. So you won't see any, big booty women walking around that I had anything to do with. But yeah, it is. First off, you always want to be conservative. It's always better to add more perhaps than to overdo it, to have someone come back and maybe, refine things than to overdo it up front. And again, it's just with our society, and now you log on to Facebook, social media, Instagram, Twitter, Snapchat, there's all this stuff. We're very visual society now. Whereas 15, 20 years ago, we didn't have all these applications. And so, you just went down the street and you commented if someone, you found someone attractive, or it wasn't pushed down our throats what's supposed to be, the popular thing, as much as it is now. I mean, everywhere you look, you see a billboard for a model or for plastic surgery, if it is, or, anything. So it's just more in our face now.
Yeah, no, I think you're absolutely right about that. And, it's a concern, because I wonder, how far is it going to go? Like, I understand it's a profitable industry. But I'm also wondering, how far is too far, and when is enough enough? Like, if, again, because of the pressure and the exposure from social media and the pressure from the industry, when is enough?
Yeah, I'm starting to see actually it kind of come a little bit more full circle as far as lips. Now, again, I don't deal with breast or body work, but maybe 3-4 years ago, everyone wanted like these full lips, as you mentioned, and then unfortunately, then a lot of I would say specialty injectors got in the game, right? And you could go take a weekend course, and now you're the world's greatest Botox injector.
Okay.
And so, as someone, I spent 15 years training to become a plastic surgeon. And, there's a lot of nuance and artistry in what we do. There's obviously understanding of the anatomy. And now, fortunately, I guess in a way that duck lip is gone away, thank God, or at least I'm seeing a trend away from that and towards, more natural and just like subtle enhancements. So yeah, I can't stand when I see that. I'm almost embarrassed for my profession when I do see that. And I encourage anyone out there just to be conservative and just do little by little.
And I think the other thing is that it's happening, like you said, so much younger. And you see, these young women with, like you said, enhancing their lips, and it doesn't even go with the frame of their face.
It doesn't.
It creates a crease.
Yeah.
It looks so unnatural. And I'm just wondering, like, who's saying that's okay?
Yeah. It's just coming down from, their favorite, perhaps celebrity, or, there's all these TV shows out there now and about, with
reality.
And it's tough. So yeah, I really try to, talk my patients back from anything drastic.
As clinicians, we think everything should have a psychological evaluation before doing it. It's how we see things through our clinical lens. Do you think plastic surgery should have a similar prerequisite?
I think there are some offices that's tough, because, there are patients who come in with very clear-cut scenarios where it's, I don't know, 9.9 out of 10 people would say, okay, I agree. There's an identifiable issue that can be fixed, and you could restore confidence to that person. You can quickly impact their life. And in those scenarios, perhaps it may be unnecessary and just add to healthcare expenses. But in other instances, I think it's definitely prudent, and it's make sure that they're doing this for the right reasons. They're not being perhaps forced or manipulated by a partner or anything like that. So it's, if a clinician has sound judgment, I think they can perhaps make the decision if they feel like it's necessary to go that route. But I do see it from both ways.
Yeah, I guess the idea is that, like tattoos, of which I'm very fond, can be addictive, and I know I would get more tattoos.
Yeah.
And so that's what I wonder is, how do we make it more of an ethical practice so that doctors don't have a choice but to abide by it? Is there some way to sort of manage that more effectively?
As we graduate medical school, everyone takes the Hippocratic Oath, and the first thing it says, first do no harm.
Do no harm.
Yeah, and so that's just on. There's going to be a couple bad apples in every profession: doctors, lawyers, actors, you name it. And so that's just life, right? You're not going to be able to weed out everyone, but it should be in the back of every physician's mind is first do no harm. So I think that's at the core of our profession.
It's funny, Dr. Dimitri, I don't know if you know this, but JD was my professor in grad school. And the first thing she said to the class was do no harm, and held us accountable for every interaction we ever did in class. Yeah. And so I'm wondering, for you as clinicians, it's really hard for me, and I know for JD, we see everyone through a psychological or a clinical lens. Mm-hmm. Do you look at everyone through a surgical lens?
Probably in a way. When I consult with the patients, I look, they of course fill out intake forms, and I see what they're here for, and I can kind of quickly, if it's for a rhinoplasty in less than 20 seconds, I can pretty much gauge what I would do and what I assume is bothering them. But it's tough not to jump to conclusions, because sometimes you'll be they'll throw a curveball. But I do think now, and even my fiance, she'll ask, she's got a very good eye for this stuff too, and I'll be thinking in the back of my mind, oh well, this may benefit that person or that. But it's out of the good of my heart that it comes out.
Appreciate you being honest about that.
Yeah.
I can just imagine what that would be like for you.
Yeah.
So plastic surgery is a lot of elite and elitism, right? And you talked in the beginning about doing work in cancer research and parts of medicine that may be a little different. In what ways do you still contribute to giving back to society outside of? Yeah,
for sure. So actually my mentor and Dr. Andrew Frankel in Beverly Hills, we had a very interesting scenario. I guess it was a couple years ago now, where there was a patient, Ketchy, and she's actually famous because she was on the TV show America's Got Talent. And she has a beautiful voice, and unfortunately, she was involved in a plane crash, of which she was only two survivors. I think it was almost 200 people died in the plane crash.
Wow.
And she suffered just terrible burns. She's an African-American patient, and just like the sweetest girl. And her face, there's parts that now the skin has become white, other areas she's got scars all over her face. And so she had, I think, almost 75, 80 reconstructive procedures before she came to us. And so Dr. Frankel and I operated on her, and he did an amazing job. We released a lot of her scars, and just simple functions like be able to turn your neck and close your eyes. And so I think she was very grateful for that. I'm very privileged to have assisted him on that, and definitely very, very proud as well.
Yeah, that's going to make you feel really good.
Yeah.
That's
Yeah.
a great story. Okay, for a little bit of levity, for those of us who are sitting in the middle of the pandemic and we're at home, what beauty tips do you have for women that look like me and women that look like JD, women of color? What are some simple, I'm going to grab that one and eat it like a snack?
Yeah. Well, I mean, that may be a better question for Jennifer Lopez. She said she's never had Botox or anything, and she just does olive oil and lemon juice, or what was it? So,
Come on.
Well,
Come on.
okay, but from your experience,
That's a good.
yeah. No, I mean, it's really important to have a good skincare regimen. So there's a gazillion lines out there. In my office, we really like Obagi products. So to have good skin cleansers and moisturizers, I get a lot of patients who complain about the dark pigment under their eyes. And so I definitely recommend a skin brightening cream there to help with that. Because there's only so much like filler, for example, could do. Really, you have to get on creams too.
wow.
A lot of people yeah, exactly. A lot of people like to use one of those dermal rollers that helps kind of resurface their skin, promotes new collagen formation. That's an easy thing to be doing at the house.
The jade one? The jade one?
Yeah, that'll be fun. Yeah.
Go you, who knew?
Thank you. Thank you.
Okay, I heard you say on some podcast that mayonnaise in the hair.
It could, believe it or not, hair's been a popular thing actually in my practice. So I do a lot of hair transplants. Actually, we had one today, and I've worked with a compound pharmacy, and so a lot of males are concerned about the side effects of Propecia or finasteride. I mean, it's only 1% or 2%, but some of them can have sexual side effects such as decreased libido or erectile dysfunction. So now, instead of taking the pill, we have come up with some topical drops. So if you apply it topically, you don't really get the systemic side effects. So that's a nice thing. And even for females, there's it's called Viviscal, and that's a pill, and it's great.
I use it.
Yeah, there you go. Yeah, there you go. And it's great for supporting your hair. And you may see a little bit of hair growth with it, but it certainly helps slow down the progression of hair thinning.
No, it really works.
Yeah.
So is mayonnaise a thing? I just need to know.
So if you put it at the root, if you put it on the hair follicle, it won't really do anything. But there's been a little bit of evidence to show that it may help at the follicular level.
Okay. All right. Light or regular?
100 years ago, I used to use mayonnaise and olive oil as a hair conditioner. So let's
exactly.
Back around again. I have a question for you.
Yeah.
I know how important it is to have a plastic surgeon work on you, because one time when I was in a session with a kid outside, I walked into a tree branch and it tore my eyelid. Ooh. And I went to the emergency room with blood gushing out. And this guy must have used, I don't even know, to sew it up. It's still swollen, it's twisted. And so I don't think people understand that side of plastic surgery, like how important it is to have somebody who knows what they're doing, when you're in crisis like that. Like that's the part that doesn't get a lot of airtime that I really appreciate.
Yeah, no, you're right. And so just a quick little background. So I'm the youngest of 3 brothers. My oldest brother is a heart surgeon, and my other brother is a vascular surgeon. So no one in the family asked me for any medical advice. Of course, they go straight to the real doctors. Right. But I'll tell you, whenever one of someone's kid or a relative's kid, trips and falls and they got a cut, they immediately call me.
All right.
And so to get to your point, you're right. It's important. But I no disrespect to like an ER doctor or perhaps a nurse or someone, but like they probably won't pay as much attention to closing your cut as I will, or is trained. It's what I do all day is suture on the face. So it does make a big difference. I've had probably 3 or 4 friends over the last month who've reached out to me about their kids who've had cuts, and I love helping those in those situations because it really can help prevent scarring in the future. So it's very important to be meticulous in those instances.
Well,
Well,
look,
he's in Tampa, JD, and you're in Florida.
Yeah,
So
right.
maybe there's a meeting to be had.
Yeah, I'd like to find that doctor who sewed me up. Offense to him for sure. It wasn't a good. Well,
Okay,
Dimitri, I
take
just
us
want to thank
home.
you so much. I want to thank you so much for being here. It's been great to talk to you. I know we could have had 1,000 more questions, but you just got out of surgery and you were kind enough to join us. And I have another question for you.
Yeah.
So if you could do one thing to change the world, what would it be?
Oh, that's a tough one. I mean, oh God, I mean, right now in our society, I mean, unity, it feels like we've never been more, divided, male, female, black, white, Republican, Democrat, you name it. So it would just be nice if people could see both perspectives, if we could find common ground, work together. It just, it's too bad things kind of got to a boiling point, I think, recently. And, we're all, I think at the end, it's kind of, oversaid perhaps and cliche, but I mean, we're all American, right? We're all proud to be living in this country, or we all should be. And it's a privilege to be American. It's a privilege to live here. It's a privilege to have the freedom and to have, soldiers who fight every day for our freedom. So I just, wish that we could all come together more and see, both sides and be respectful. I think a lot of somewhere in the last, 5 years, 10 years, whatever it may be, there's been a loss of respect. And I think we need to reestablish that.
Yeah, I hear what you're saying, and I totally appreciate it. I also feel like we have to be honest about the history of this country.
Yeah.
And start teaching people the truth. And I think that, once people receive validation for what they've been seeing all along and knowing all along, then you can start to have honest conversations that heal and change systems that are corrupt. There's a lot of corruption that prevents that unity, and that has to be looked at. So I appreciate your perspective, and I just thank you for a thoughtful interview. It was really great to hang out with you and talk about this.
Yeah.
Of course. I had a great time. Thanks so much for having me on, and look forward to coming back in the future.
Yes, absolutely.
We'd love that. Can you tell me where people can find you?
Yeah, for sure. So I go by Dr. Dimitri. My last name's too long for most people to pronounce. It's Arnatakis. I have an office here in Tampa, Florida, not too far from Tom Brady's house, actually. And then I also have an office in Beverly Hills, California. And so I pretty much go back and forth. And I have patients, honestly, from all over the country who come visit both offices. And I love what I do, and I'm very, very passionate about it.
That's awesome. Well, I agree with you.
I love it. And, we can hear the passion. We can hear the passion.
Good.
And I agree with Susie. You are a cutie patootie. So thanks for coming on, Doc. I appreciate you.
All right. Thanks so much. Appreciate it. Have a good night.
Okay.
Bye-bye.